Hi, I'm Grant, first year MD student. As you know, this is Vlog-1. So I'm going to get straight into the questions because last time I ran over on time. What do I think it means to be a professional? I think being a professional means exemplifying some personal and societally and culturally imposed values. Some of those values, I think, is specifically to being a healthcare professional are being just a well-adjusted adult individual, courteous, kind, interacting with other people, socially competent, making good friends, working well in teams, being conscientious, getting your work done when it should be done so that other people can provide the best possible healthcare, like with regards to like getting your documentation done on time. Good communication skills, good teamwork skills, being an honest and humble member of the team so that you can adequately appreciate other people's input and take it seriously. I think also with regards to this, you got to have a committed, reflective self-improvement practice. So when we're in training, we're going to get lots of feedback, but at some point that's going to stop. And if we don't have a practice of being reflective and improving, moving forward, then I think that our growth is going to kind of stall. Certainly a cultural impact to that, specifically my values of patient-centered care is probably not entirely culturally portable. If you're taking care of different cultures, perhaps maybe the most important unit would be like the family unit or the community, and taking care of the family and community as a whole, and seeing how that individual that's sitting in front of you at the consultation interacts with that community and family unit, and what sort of goals they may have for their health or the health of their group. I think that I bring a lot of kind of maybe more Western-centric individualism, rugged individualism into that sort of. Do personal values play a role in professionalism? I think absolutely. I think that they're kind of the building block. I'm in this profession because I have a set of values, and I think most people that are in medical practice or medical providers have a set of values. We want to help other people make the world a better place. And then we have to have the certain values that got us here, to speak to that conscientiousness. I don't think that you make it very far in a profession as competitive as this if you are not conscientious, for example, and getting your work done. Specifically, has anything in the last 10 weeks helped me grow as a professional? I think absolutely. This has been a really diverse educational experience for myself coming from the United States. And I think that that's going to have like numerous impacts, some of which I may not necessarily appreciate, but it's going to give me a lot of perspective. Additionally, I've come into medical school here with a little bit of prior clinical experience, and I think that's made me a little bit of a resource for my peers, and I think that's been a lot of fun, very rewarding, and I think that teaching and volunteering in kind of medical education is probably a route that I want to continue to pursue. In fact, I've signed up to volunteer with the Path Learning Center out at Royal, and I'm really looking forward to working with some of those like 10th, 11th, 12th grade students. We would call that high school. I think you guys call it college here, huh? I think being a professional is both a personal and an externally attributed identity. I definitely strongly personally identify as a healthcare provider. I've given quite a lot of my life to it. I find it extremely rewarding, and I assume it as kind of an identity. It's something I carry with myself all the time. I often introduce myself as a PA, which maybe sometimes is interpreted as a little bit déclassé, maybe, or just a little cringy, maybe, is the way the Gen Zers are saying it. But I really do feel strongly like I think that the values that are inherent to this profession are deeply in alignment with my own personal values. And so when something like that matches up so well, then I think that it is, it kind of morphs into the one identity. But at the same time, it is externally defined as well, right? We have all these legal and social frameworks and social contract of being a healthcare provider and that sort of thing that are extremely important and shape the way that we interact with our community and our nation and, our culture as a whole. So I think kind of both aspects of those. I'm going to stop here. I think I'm already a little bit over at 5:30, but I really look forward to meeting with you, my advisor, and we'll have a good conversation then. I appreciate it. Bye.